There are a lot of myths between strip or FUT surgery and FUE surgery. Let me clarify them today. 67.5% surgery in the world today is by FUT or strip. It is the golden standard. 32.2% FUE. FUE is good for a small area but limitations for a large area. So what do we do in a strip surgery? We take a strip 1 to 1.5 centimeter wide, which is little around half an inch, from the permanent hair bearing area, including the hair and the hair follicle. If I take a strip 1.5 centimeter wide from here, what will happen? There will be a gap, there will be a wound, there will be a raw area. If I stitch it up, there will only be a line, there will be no gap left. So I remove this strip and stitch it up. There is only a line, cover the rest of the hair, there is no gap visible. Even immediately after surgery, when you come out of the operation theatre, nobody knows from where the hair has been taken. This strip of hair, using a microscope, using loose magnification, we cut out the hair individually its roots to get numerous follicles. Depending on the number of follicles I've got, I'll make small gaps so you don't have hair. In FUE, the system is a little different. What we do, we cut the hair short all over the scalp so that there are only 2 millimeters of hair sticking out. Then I take a punch. I try and go straight through and try and pull out the hair's root. Because it's a blind technique, I'm not seeing below the skin. In a 2-degree mistaken angle will cut the hair root. So in the best of hands in FUE, there's a loss of 5 to 30%. Strip, the loss is only 1 to 3%. Secondly, in FUE, if I take out this follicle, I cannot take out this too. If I take out this, I cannot take out the next two. If I take out 2 adjacent follicles, there's a bald patch. Strip, I can take out all. So in FUE, you will not get more than 2,000, 2,500, 3,000, maximum 3,500 follicles in one sitting. Strip, I'll get 4,000, 5,000, 6,000, 7,000, 8,000. Harsha Bhogle is 7,400 in one sitting. Also, what the mistake many FUE surgeons make, they go beyond the permanent area. They take hair outside the permanent zone to get more hair. Those hair not being permanent may fall off after 4, 5, 10, 15 years. Thirdly, in FUE, you have to shave your head. In India, nobody shaves unless there's tragedy in the family. People ask you, why have you shaved? It will take 3 months for the hair to grow back. Everybody notices that something has been done. Strip, nobody shaves. You don't need to shave. The moment you go out, nobody knows from where hair has been taken. I'll show you videos, you can't see whether anybody had a hair transplant or not from the donor area immediately after the surgery. Fourthly, in FUE, the scarring is much more than in strip. What they advise is totally wrong, it's misleading. Strip, there's a fine line. There's a special technique of closing called Trichophytic closure. Hair goes through the scar. You can't see the scar when you roll your fingers through the hair. I can show you many videos of patients, you cannot make out the scar. FUE, you'll only see the scar when you shave your head. When you shave, you'll see a fine line and a strip. FUE, when you shave, and I've done 2,000 punches, you'll see 2,000 dots like a Chinese checkerboard. 2,000 dots is much more than one fine line. The last biggest problem in FUE, because of the punch being used and trying to take out the hair very fine, many times we damage the stem cell around the follicle. The hair fall off and do not grow back after 3-4 years. Strip, they are permanent. You see, I did a hair transplant for Shastri in 2006, Arun Lal in 2007, Lalchand Rajput 2008, Harsha Bhogle 2008. They still have all their hair intact. Sehwag got an FUE done in 2009. By 2012, he lost 70% of his hair. It's your choice. I do both the techniques. Strip is a universal technique, the golden standard. 67.5% surgery in the world today is by strip. 32.2% by FUE. FUE is an easier technique. You see a lot of dermatologists, dentists, gynecologists, urologists, a lot of clinics use Ayurvedic doctors, homeopathic doctors. You don't know what the qualified doctor is. They're doing FUE because it's an easier technique. But if you remember, you get less hair, you have to shave your head, you have more scarring, and most importantly, you do not know how long the hair will remain. I do both the techniques. It's your choice. It's your take. You decide, and I'll do it for you.